Hi, and welcome to this series of mayoral candidate interviews hosted by Ahakshanink and presented in conjunction with 1623 Studios. In these interviews, we will discuss issues related to economic opportunity and the challenges facing low-income residents of Gloucester. I want to thank the candidates for their participation in these conversations about important issues facing the community. Each interview features the same questions which were shared with the candidates in advance. We hope you find their answers informative and would like to encourage everyone to get out and vote on November 2nd. Mayor Savathi, thanks so much for joining us today. I really appreciate you taking the time to sit with us and talk about some of these really important issues.
Well, thank you. It's great that we're talking about it because it has to, because we were on a standstill because of COVID. So it's really nice to, hello people, these things are still here.
Yeah. So,
even worse though, but
yeah. So Ahakshanink has been serving the Cape Ann community since 1965, and through our programs we help our friends and neighbours achieve stability and access opportunity. And we also advocate for the types of change that will make ours a more equitable and resilient community. What role do you believe local government can play in reducing economic inequality and fighting poverty?
Well, you know what? We've been doing it, but unfortunately, because of COVID, we stopped and we had to do a different quick action approach. You know, we didn't realize that the stimulus package was going to come. We didn't realize that, you know what, extension of everything. We were on a go, and my first priority is we had a lot of homeless people is, you know what, where do we do with them? What do we put them? That's not fair that, you know, they don't have a residency and they can't, and because of COVID, people were so afraid that they didn't want people sleeping on their couches. They didn't want that like we would do during the winter, and it was kind of difficulty. What we can do is continue to do is work with our state legislative and the governor, and also keep building these affordable housing, the real true affordable housings, and make sure that no more 40Bs are thrown at us, so you can have those kind of affordable houses. We need to go to the governor. I put a plan through saying that we need to do a reverse roll, and I'll bring that up quite a bit, is because, you know what, we wait till the end, then we have all these people that are homeless, and then we want to get old hotels and then put them into little rooms for, you know, what we can do. Well, why isn't the state purchasing these and really making them homes? If we have lack of housing everywhere, the only way we're going to be able to stop that. And also is that 30% that we have to do, and to make it equitable, is that we need to really focus on different things, because not everyone can go on Section 8 workforce houses, but we need to remember too, first, last, you know, security deposit, references. That's kind of hard if you are low income and you know what, you might not have good credit. You're working to actually establish yourself. And it's difficult, and it's also difficult for a person to actually even accept a raise, even to get above that to afford those things, because what are the rest of the benefits you're going to lose? I've seen it, you know, why aren't you applying? You should be that. She goes, well, I did the calculation, and if I get like $40 more, I'm going to lose my health care. I'm going to lose the assistance in health care, because some of them get like assistance, so you can get your employee's health insurance, but also get assistance from the state. It's not worth all the stuff they're going to lose. So not only are they getting really emotionally withdrawn and doing their job, but feel like they're never going to come out of it. Even if they wanted to, a lot of them have to live with, you know, two families in one household, or still with their parents, is because of the first/last security and the high rents. So, you know, we can talk until we're blue, until the state comes up. Now, he has $5.5 billion. I want my share of it, and I want him to start refitting some of these old hotels and motels into real housing. So you look at, I'm not going to put anyone down, but look at Denny's. It's sitting there in Danvers, wrecked. Maybe having 200, you know, units or whatever. You can make good units there with the backyard. You don't need 100 units. You can use small units. And if we keep doing that and saying to him, or whoever is governor, whoever, you know, is in the state house, we're working backwards. Can we work with the agencies who actually know what's going on? Because it's easy to put someone in a place, but you have to let them be able to call it a home.
Well, staying with housing, in Gloucester, housing, of course, is the most significant issue impacting the community. The latest data show that almost half of all households are cost burden, which means they're spending more than 30% of their income on housing costs. This means that for too many of our neighbours, that's less money to save for an emergency, less money for food, for medicine and so on. As Mayor, what steps can you take to stabilise housing costs to ensure that more people can afford to stay in our community?
Well, it was some part of the first segment that I was talking about. Unless there's some kind, and then people are not going to vote in for rent control. It's my house, it's mine, and it depends what the mortgage is, depends the high cost they got it. So that's so complex because it's so easy. Well, you can do rent control. No, you can't, because the fact is, when someone buys a two-family house at a very, very high cost, but because the interest is low and they really are giving out loans, your mortgage is still astronomical. Person thought he was buying a house and it was a two-family, and he figured his mortgage would be $2,000. Well, when they didn't tell him, add your taxes, add your water, add everything else, there's no way. And what does that go? On the effect of the person who's going to rent. Affordable housing is what we need, workforce houses like we did with Cameron's project. But the brutality to go through it, to get the process, to get there, you've already lost like 5 years, okay? And if I didn't get that call from the governor to say, May, you have a choice, either it's Cameron's project or you're gonna have to do this project. Well, both projects are very important. Of course, affordable housing was number one, but the fact is, shouldn't a person who comes with the great agencies, who knows about homelessness, who knows how to do things right, and say, we have this plan, we bought the building. It's not like we're asking you to give, we're asking you to help us so we can sustain everything so it is affordable housing, real workforce houses, so people can actually say, I can. They should be saying automatically, this is what you get. You follow this. Like, why is it okay if 40B can threaten us, come in, and then do what they want to do without nothing, but yet someone who wants to do affordable housing has to go through all this bureaucracy and then play games of who's going to get the loan? It should be backwards. Affordable housing with companies, we all know who they are, and I'm not going to name them because I don't, in case I forget one, but should be able to say, we follow this criteria, here's our process, here's what it is, let's do it. You'd get more affordable housing faster, people will find homes, and then we can sit there and say, okay, now that we have that, I guarantee you that the market flow of not be able to find an apartment, it will decrease because people will not be saying, I need all of these things. Because the old Gloucester, it used to be, oh, I know him, don't worry, you can, he's fine. That doesn't exist anymore.
So staying with affordable housing, well, Gloucester has taken many steps, inclusionary zoning, and made progress on a number of fronts. As you mentioned, it's still a significant challenge to bring affordable housing to the community. Municipal leaders can do even more to help. In some communities, they have enacted affordable zoning overlays. They've increased unit requirements well above the 10% that exist in most locations. They've brought more city-owned land into consideration for affordable housing and earmarked additional funds to be used on these developments. Do you support measures like these in an effort to bring more affordable housing to Gloucester?
Not only do I support it, I've been working on it. We've been looking at a lot of things of what's going to happen. We have businesses downtown that would want to expand above their businesses, and we have to change that zoning. We also had, we have artists that wanted to actually have like a workforce house where you can actually have your studio, be able to live, and they couldn't because the zoning was not there. We did put one zoning in plan. It's going through the process. No more of this, 10 units, and then the 10%, we brought it down to 6. I mean, if you really want to be in Gloucester, you really want to be a good landlord, there's no reason you can't comply. And I know that, people saying, well, we weren't at that meeting, and I'm a builder, and you know what? You can do whatever you want to do. I'm asking people, instead of putting, all these extra in your pocket, you know what? Put the right amount. Put the right cost amount, because we should be able to do that. I feel that now it's even more, because the fact is so many people are going to be evicted because of the stimulus and because of COVID. Fundings ended, jobs, and they'll say, well, you have negativity. We're not together yet. Until we can get the community together again, it's going to take some time. And when we get together and say, well, you know what, We're Gloucester. We're not 01930. We're not a zip code. We're Gloucester. You know how you, so GLOSTA, whatever way you want to call it. We used to be able to say, you know what, I'm gonna build, and they used to come to us and say, you know, I'd like to build something. What we can do, we need to bring that again. We need to bring it where someone wants to turn their 3-family. If they tried, we have the in-law apartments turning, you know, by right, you know, so you can do that. And a lot of them were saying that, you know what, I'm afraid to come forward is because if I add another bathroom, you'll have to pay another betterment because you've got to connect. And we're working on that. And because there's a lot of wonderful older homes, you know, that can be turned into 2 or 3 families. And you have them also in downtown in the historic district. We have to work, if we come up with a plan ahead of time, so they don't have to go to 3-4 months and get discouraged, because the attorney fees are gonna put into that. And they'll say it's not even worth it. Well, we have to make it worth it for someone to say, you know what, I do own quite a few homes. How can we make it that it is affordable and people be able to get a home? And remember, I'm not putting down anyone with Section 8, but when Section 8 jumped up on their rental participation as far as the income that you can, like a 3-bedroom, $2,400, they didn't do it because they wanted to outcast anyone. What was happening is that they wanted every person to feel that they can go in better neighborhoods and be able to live there. You wanted to mix people in. Well, what happened was it isolated people, because now it's backwards. You know, people on Section 8 can afford the $2,500, but a working force house, like you said, and I don't know where they got that income level, $100,000. I think it's by couple, but by the time you bring everything home, you're actually, in everything, you actually only have $40,000 to survive. And that's not including people. Everyone goes, well, they don't need cable, they don't need this. That's not even including the extras, okay? A person making $60,000, take your taxes out of that, pay your rent, and then take basics, not even including a birthday party, not even including anything you want to go out, basics, you still can't survive.
Yeah. Well, staying with that, as you mentioned, the high cost of living, despite the high cost of living, Gloucester's median household income is just over $65,000 a year, which is well below both the state and the regional average, and is also significantly less than what would be considered a living wage in Essex County. Overall, 20% of Gloucester households survive on less than $25,000 a year. What steps do you plan for your administration to take to address this challenge and to bring more year-round living wage employment to the community?
We have to work with the state again. And I'm not saying everything has to be done with the state. What can we do ourselves? It's really important because, first of all, you said most of us, because we know it here, is 65. But when you look at the national level and they send all these things statewide, where they're saying that the average person here makes $100,000. I still think they're combining the income to 2 people. Because you know what? I'm looking around, and that's, it could be true, because why? People are working 4 jobs and exhausted. So what does that mean? Taken away from family time, taken away from himself, mentally. So how do we do this? Well, we got to go back to the old ways where if you wanted, excuse me, you wanted to increase your income and your employer wanted you to, but you're afraid to because of the benefits you will lose. We used to do years ago, because I was on that champion getting that. So let's say you got a job and you want transitional assistance. If you got a job, they allow you to keep the health care for a year. They allow you to keep your certain programs for a year. Well, you know what? Instead of doing all of these things that we're going to do and having all these plans that I brought to sit there and whatever and look at them only during the election or whatever, but I live it. I live it. I work with it. I come up with something. Let's do, you know, something backwards. Let's do something proactive. And I asked him, I says, why aren't we putting that program back? Because actually, to me, if you get a person who's making minimum wage, which is unaffordable to anyone to go live, you're going to have 2 or 3 jobs. But if you want to get that raise, or they want to, because right now everyone's fighting for employees and they're paying high prices, and you don't want to because you're afraid of the benefits you're going to lose. Well, why don't we did that during COVID. We put in a a package that, you know what, no one was going to lose their health insurance. No one was going to lose this. No one was going to lose these programs. Why don't we work on a plan? We all have there's like hundreds of millions of dollars for blue collar economy. While they're in training, or while they're doing this, or while they want to improve themselves in all these blue collar trades, why don't we say that, you know what, you're not going to lose your insurance. So if you're on premium assistance, or if you're on the connector, if you're on the Medicaid program, you're on that, you will not lose that program. And that would give them initiatives not only to continue, but then it also say how you're going to survive. Help them learn how to survive that when they do have to get taken off. How do we do it? What is really the income you need to survive? Because I don't care what anyone says, okay? Even if you went to get a $20 an hour job and you have to take your taxes, everything out of it, and then you have to pay your own insurance out of that, you're not going to take that job because you're going to lose so much to take that job. So what are we doing to say, yes, you can take that job, because that job or the training you're going to do, not only is going to be 20, it's going to be increased because you get to keep your insurance for a year. And then from there, you'll be able to know what's going to happen and how you're going to do it to survive. Because there's got to be programs set up. Programs that you want to help people to get out in the workforce, not to force them to stay home because, you know, you have children and you need the health insurance, or some of the extra SNAP they're getting, or the Action Energy program, or the Fuel Assistance program. If you look at all these different programs, sometimes $20 will kick you out of all of these programs. You cannot afford to stay in your own apartment. You wouldn't be able to afford your family. You wouldn't, I don't know what to say to people. It's unattainable to do that. So let's work backwards and keep that there. We did that years ago. We should be able to do that. And there's so much money, and we're putting all that forward. Mm-hmm. I mean, he hears from me all the time going, you're doing it wrong, you're doing it wrong. You know what? You need to talk to the people who've been there, not the people who have high-paying jobs in an office, please.
Well, changing gears a little bit, over the past 10 years, the percentage of English language learners in Gloucester public schools has tripled. These ELL students have a dropout rate of about 21%, which is 7 times the average for the student body as a whole. In your public statements, of course, you know, you've referred to your own immigrant heritage. As a community, how can we ensure that Gloucester is as welcoming to this latest batch of newcomers as it has been to families like yours?
I don't understand where people think that, you know, if they're dropping out of school, it has anything really to do with the school. We have a great high school program, so you have to understand most of your students who either start young and they'll stay in the school system, but if you have an older sibling, or if you're coming now and you're 16, 17 years old, you'll stay in the system, you can to up to 22. It's very welcome. We have great teachers, we have great programs, and they trust the teachers. You have to understand the background, people. You can't say, well, you know, I don't speak English and everything's fine. You have to understand where they're coming from, the culture. Some of them live in fear every day, okay? Live in fear every day. And some of them you're born, how do I put this? In some of the countries that they're coming back, and so I don't insult anyone, I'll go to the Sicilian community, okay? Sicilian community, I know that when people came and stuff, or including my first husband, you would ask them, did you ever have a dream? What you want to be when you grow up? They didn't. If you were farmers, you were farmers. If you were fishermen, you were fishermen. You came here to the United States to make a better life, and you came here to work. So you're 17, they'll put you in school because they want you to learn English, but if your family's not surviving or something's happening, and if you're a man, now you have to understand this, there's no offense to anyone, the man in every household is supposed to be the one who is the breadwinner. You are born and you are like hypnotized. All your life, you have to support your family. You have to support your family. You have to go to work. You have to do that. And if your father can't, the oldest son will. So these children who are coming here, they would love our schools. It's not they don't want to, but things change, or you don't know who's in the White House or what you're hearing and what's going on. The fear is number one. And so if they're the ones that be able to work, they have to go to work. There's no if, ands, buts about it. You know what? And you know what? I have kids who are working 2 or 3 jobs. They're leaving, example, I'm not going to say name, Domino's at 2, but then going to a bakery at 3. And then they'll go home a little bit, sleep, and then do that again. They're not going to be able to go to school. How do we do that? We're doing night schools, but you know what? Some of them have to work at night. What we need to do is figure out how we can help them when we used to do the work programs years ago. How do we help them? Like, I was working with GMGI, a great children came from Roxbury, Nansbury, and I went to go visit them, and a lot of them, I was talking to the kids, was so amazing what they want to learn and do. And they were saying, I would love to do this, but I won't be able to next year because I work in the summer, and that's how school closed. I was one of those kids. Started at 14, used to be the CETA program, and actually then I went to NUVA because I worked with NUVA. I was the rent-a-kid. I was the coordinator. And you helped out your family. You know, not everyone, if you're low income, not everyone's going to have, you know, the little whale that's there or the little Nike sign or anything else, but you want that one time. Your parents can't afford it, but you want one thing special for yourself, but you also have to help them. You're going to go to work. You're going to work during the summer. And you know what? You're going to bring home whatever you can, and you're going to contribute. And then if you get a little bit extra, you're going to spend it on yourself. Why can't we do programs that children who want to expand their horizon, just don't want to do the same thing, be able to come? And we have like a CETA program where you can work and learn at the same time, and actually get paid for it. That's a big difference.
Yeah. So again, changing gears, the last question we have here is about behavioral health. So despite increased attention and focus, behavioral health does remain a significant challenge in our community, often disproportionately impacting residents who are living with low incomes. Issues exist around capacity, with Essex County having fewer providers than the state average. And there's further challenges in things like transportation, insurance coverage, and health literacy. What role do you think municipal leaders can play in addressing these issues and ensuring more equitable access to care?
Do you want to see me pull my hair out now or later? That's that.
Yeah.
I had an emergency meeting pre-COVID in my office. We had 18 behavioral health people from Addison Gilbert Hospital, people on speakerphone, Secretary Setters, and Senator Tar, because we had children who were waiting in the emergency room for 14 days and with no help. So we needed to do something because it was really mind-boggling that you have 1,200 juvenile therapists, 900 don't take insurance. So what does that say? So when Secretary Setters was speaking and she was talking to one of these parents that was there, and she says, well, you know what, we got to get more to get Medicaid. He goes, ma'am, I make over $100,000. I can make more if I wanted to, but I have to stay home. And he said, I have the best insurance, Blue Cross Blue Shield, the best of the best. Can't find therapists, and when they do, they get burnt out. They get burnt out. I saw it at the hospital when we worked at behavioral health. They're exhausted. First of all, they're not paid right. Even if you have behavioral health, and I'm not saying Addison Gilbert, I'm saying any kind of behavioral health, they don't get paid right. They really do, because either they're beginning or they're social workers or whatever's going on, and you have one psychiatrist who will be able to do the medication. They do not get paid enough to do what they're doing. And so we were looking at all those avenues. Then we had the first ever in the city of Gloucester, we had a hearing here. There was about over 500 people showed up from all around. It was the last one. And we're waiting for that report to come to a conclusion because obviously Secretary Setters, Department of Public Health, had other things to do the past year. There was a woman who says, don't look at me, look at me because right now I'm dressed like this. She says, a woman of color, do you think I have no education? I have the best education. I can go anywhere, but my child was not getting the right care. And if I don't help my child and stay home, you will lock my child up because that's where he was. We don't have the facilities. Now, we did it with the Angel program. We brought awareness to addiction. We need to bring awareness that why are not these hospitals or any facilities getting the right amount of money to make beds for these children? We have them 20 expanding at Shaughnessy's in Salem. I was working with, you know, the rest of the mayors too. Anna Jakes is capable of expanding. We have that. It's the therapy. It's the insurance companies not paying. Well, I even talked to John Rosenthal and said, you know what? Perry actually coexist with mental health. If a child does not get their mental health when they're supposed to, where do you think it's going to end up? It's going to end up, that child's going to age out. That child's either going to hurt himself, hurt others, addiction, jail, or all of them, because I'm working with DA Blodgett's office on this too. It's so important. So what I want to do right now, quickly with what we can do, is work with the children. I'm talking to Odd Haven, therapy, artist therapy, dancing with therapy, but they're still limited. So what I want to do is talk to some of the college, get some of the social workers combined with artists so we can work together and get that kind of a therapy for now until we can work on it statewide.
Well, Mayor Savathi, thank you so much for taking the time to sit with us today. I really appreciate your answers and the information you were able to share. And best of luck with the campaign ahead.
Well, thank you very much. And if anything I can say to everyone out there, we really need to pull together. If you have a rental apartment and you're afraid, talk to Action, talk to one of the groups, talk to Open Door. You know, I was so pleased when we had a place to go for, 48 residents, because the YMCA became their residence. In the beginning, it was kind of hard, but after, they all became like a family. 18 were placed in homes because the city could help with HUD money, be able to get first and last. We need to continue that. You need to remember, Action is an anti-poverty agency, but it's ours. We're lucky we have it in this city, but we forget that it's there until you need it. We need to make sure that we get the right amount of funds for Action, because of not just the energy program, not just because of fuel assistance like we're doing. We're so fortunate. We have the Grace Center. We have, Open Door. We're so fortunate with these programs that we have. And now that you're all coexisting is amazing. And that's what we have to do in this city in order for us to do anything to move forward.
Thank you.
Thank you.